Good evening, and thank you very much for that. I can't tell you how thrilled I am to have the opportunity to follow the Reverend Hamilton. I know it's an honor, but it's not the pleasure that I was hoping for. Somehow I drew the short straw here. If you recall the great words of the Reverend Hamilton, he did mention the but. He asked you to give him a but, and he asked you to give him a however. I am the but and the however. It is an honor to be here tonight, and I congratulate you, and I'm proud to be with you to celebrate your 10th anniversary. I must say that I don't know if any of you were there at the beginning of Sesame Street years ago on television, but if you remember, there were like 3 carrots and a bean. With 3 of the most distinguished folks in public service here, the governor, the speaker, and the mayor, and then they throw in an old ad guy. I am the bean. Some of these things are not like the others. They have spent their entire careers serving others, and I am so proud to be in their company this evening. In fact, I must say I'm very proud to be in all of your company this evening. This is a wonderful inspiration for me. Even to see my pastor, if you will, the Monsignor Carlson. I grew up in Rosendale and worshiped at the Holy Name Church in West Roxbury, and I'm more than thrilled to see Holy Name Church represented here tonight. So as I come to you this evening as the chairman of Partners Healthcare, and I do have a few prepared comments. I'm not as good off the cuff as the Reverend Hamilton. I'm not going to try and compete with him. But I do have some very heartfelt comments that I would like to just share with you, and I appreciate your patience with me this evening. In preparing for my remarks, I took the liberty of taking a peek at your mission statement. One sentence stood out, and I quote, "Our primary goal is to develop local leadership and organized power to fight for social justice." Your history suggests that the founders, those folks behind me and others, were motivated to build a new organization which could help build relationships across the many historical divides, as you've heard and witnessed, and to provide a new vehicle for many to act as one on behalf of common interests, and to do so in ways which would be both powerful and effective. Working together, building relationships, developing local leadership, and fighting for social justice. It sounds impressive, but in fact, what you have accomplished together is beyond impressive. It is an example of what is possible when people realize that they have more in common than they have as differences. Your fight is for dignity, and we at Partners are proud to join your fight. I'm here this evening as a representative, as is Peter Slavin, the great leader of the Mass General Hospital, and so many others, Matt Fishman from Partners. I've had the honor to serve as the chairman of Partners for the past 15 years. Actually, it's a 1-year appointment, so I'm on a very short leash. I'm on probation in my 15th year. Healthcare is important to you and to your constituents, and it's where I spend a fair amount of my time. Your strong, effective voices mobilize support for passage of our state's healthcare reform law and have influenced the key decisions about how to implement it. You've done a terrific job informing people throughout your congregations and the larger community about what the law offers, and you continue to support people in signing up for coverage. Thank you for your extraordinary vision, energy, and commitment. Our state's healthcare reform law is a promise. It is a promise that working uninsured people will be able to get access to the health care they need and the health insurance that will pay most of that bill. I think we are in good shape in keeping that promise, thanks to the hard work of many of you and of our political leaders. Together, we have done a great deal. 340,000 people have enrolled in just the first year. 47 primary care doctors and nurse practitioners have made multi-year commitments to work in community health centers, creating access for over 80,000 newly insured individuals. Most Massachusetts employers, I underline most, continue to provide credible coverage. Only 6% of our state is uninsured, compared to a national average of 16%. But we have a long way to go. Reverend Hamilton talked of shared responsibility. We will need more money. We will need to thank the good employers and bring even more to the table. And we need to work together to manage the rising costs of health care. In closing, I would like to share, and the mayor is very happy to hear me say in closing, by the way. I would like to share excerpts of a speech given by a great man who you know, who has done so much for so many, and who has provided leadership and example in the fight for better care for all. And I quote, "The commitment I seek is not to outworn views, but to old values that will never wear out. Programs may sometimes become obsolete, but the ideal of fairness always endures. Circumstances may change, but the work of compassion must continue. It is surely correct that we cannot solve problems by throwing money at them, but it is also correct that we dare not throw out our problems on a scrap heap of inattention and indifference. The poor may be out of political fashion, but they are not without human needs. The middle class may be angry, but they have not lost the dream that all Americans can advance together. The demand of our people is not for smaller government, nor is it for bigger government, but for better government." The occasion, the Democratic Convention of 1980. The speaker, our beloved Senator Ted Kennedy. Two closing comments. I ask that you keep Senator Kennedy in your prayers, and I thank you again and congratulate you on 10 very impressive years. Thank you very much.